Good mornings, everyone. Here are we back with the Coffee with Women series with Rajnika Paltia. And today we have a very, exciting personality, I would say, with us who hold 35 years of health industry experience. She's a doctor herself. Nonetheless, I'll just call Dr. Manisha Pandey. A very warm welcome to you, Manisha ji, over here. And we are delighted to have you in this series. Before we discuss more about, her work and what change she's bringing in her own ways into the world, let me just quickly let you know more about her. So she has done MBBS and MS in Gynae and Obs, and we'll know more about her. What does that mean and what all sort of patients she has dealt in her life and what has been her experience. 35 years is such a good, healthy experience to, I'm sure, deal with multiple cases and scenarios around her. So a lot of exciting talks today with her. I believe more informative talks for specifically us when we call women and how men should also look after certain things. She has treated ailments into the women health from her, as I mentioned, last 35 years, and specifically advanced cancers, cases of breast cancer, uterus cancer, and all the possible infertility, PCOS, all the kind of challenges that women go through. She has had all that experience under her belt. And it gives me immense pride. Just like me, she's also an author of the book, Being Breast Aware, 9 Lives. You can look about her book on Amazon and check more details around it. And her topic of interest, I think her work experience has led her to write this book. And we'll talk more about it. I'm so excited today to discuss so many things with you. And I'm sure it's going to be a lot of informative session, not just for me and a lot of people who are going to watch this video. So thank you once again, Manisha ji. A very warm welcome to Coffee with Women series.
Thank you, Rajni. At the outset, I must say thank you again for having me here, giving me an opportunity to interact with more and more friends of ours, the women whom we want to empower. See, I know you are very good at, you have a great compassion for women and their empowerment. I know I've read your book as well. It is about women empowerment, making them stand strong on their own feet. So this is my way of empowering women. I feel women can do great things, but first of all, they have to secure their own health. We can't expect a tree to give fruits and flowers unless and until it is strong unto itself. And this is what I have been doing for years. As you said earlier, yes, I have done my MBBS and MS, Obs and Gynae. Obs and Gynae, as you were talking about, obstetric is all about delivery, conceiving, infertility, delivery. And gynecology is about other ailments of women, right from adolescence. We have PCOS. Then we talk about other ailments, infertility we see even such a simple thing as chronic PID, leukorrhea, and at the other end, we have the cancers. So for the past 35 years, I've been working with women, treating their ailments, then, counseling them, promoting women health. And actually, this is very close to my heart. I've always believed the way to empower them totally. And I keep reminding them all the time, you have to be strong. Only then you can give anything to your family, to the society, or you, as we say, sky's the limit. Only when you are strong. So I've been working with them for years. And time and again, I've been appalled at the way women keep ignoring themselves. They're doing everything for their family, for their husband, for their children, the elders in the family, but they forget. Anemia ho raha hai, and then, they're just ignoring themselves, even such a thing like cancer. Mostly they land up in a gynecologist clinic when it is quite advanced. And that is a very sorry state because nowadays in India, we can actually treat most of the cancers. And here specifically, I'm talking about women specific cancers. Even the government of India's focus is on 3 types of cancer: oral cancer, and breast cancer and cervical cancer.
Yeah.
And out of these three, two are women specific.
Yeah, it gives me scary goosebumps when you say that. I mean, you
Yeah.
know, I am, yeah, when you say these words, and anybody, hearing that word cancer and things, of course, people feel a little, lift back. And
So
when you
women,
said
what
that, very rightly said, आपने बोला जो कि, हम बात करते हैं self love की, we talk about self love, taking care of ourselves. But there are so many areas to self love again, just like as now today we are talking with you into the health side of the women.
mm,
Um, yes, I agree. We've become neglectant of, a lot of things which are just related to women health. The kind of diseases you mentioned just
mm,
now, कैंसर तो एक अलग लेवल हो गया. आपने जैसे अनीमिया बोला, आपने you said PCOS and a lot of other things. I definitely believe that even this day हमारे इंडिया में या भारत में हम लोग उतने अवेयर नहीं हैं. And I would like to hear your viewpoint on that, because आप ऐसे cases या patients handle भी करते होंगे day to day basis में. That how a women health is different than, when we say हम health checkups करा रहे हैं, it is generally, the checkups like my BP, my sugar, my cholesterol, my body weight, and these are very generic checks. We think, okay, we are perfectly fine. Even I have done that with myself, and I'll not say that when I am thinking that I am so ignorant that I can just think about the ratio of, the percentage of people you would be talking about. तो आपको क्या लगता है कि how a general health checkup and a women health checkup is different, and what are your tips to all the women listening this video or will refer in future?
I'm so happy you mentioned this. Rajni, see, uh, we keep talking about a feminist attitude, we keep talking about patriarchal society, but this is what patriarchal mindset is. What others are doing, I can understand. But what I am doing. So when I go, most of the educated women who are self dependent, standing on their own 2 feet, but when they go for their medical checkups, as you said, most of the MNCs, most of the companies, corporates, they have this package. So women go for their checkup, but they end up getting done what is common. The sugars, the cholesterol, the TMT, and they very proudly say, yes, ma'am, all my tests are normal. And then I ask them, did you have a mammography done?
Hmm.
And no, did you have your pap smear? Do I really need it? I don't have complaints. So the whole idea of health checkup is lost. Neither the giving party is emphasizing the importance, nor is the woman aware. Because breast and pap smear is about cervical cancer. So again, we everything boils down to two major cancers of women. And
Hmm.
breast cancer is the killer number one, and number two is cervical cancer. So again, we end up talking about these two things. And the two very important tests, they are mostly either ignored altogether or just postponed. Neither the doctors are very persisting on getting it done, nor are, this is a sad part, and nor are the women going for it themselves. So the idea is we have to sensitize women. That is the basic idea. That is what I have been doing for years. You just mentioned anemia. I might be deviating from the topic, but I'll tell you what. So anemia, just like we talk about hypertension, diabetes, but we forget anemia also runs in the family.
Hmm.
Mostly I find if the mother is anemic, the daughters are also anemic. And it has got nothing to do with genetics. It is not a disease which is handed over through the generations. The only thing is the woman is not sensitized, so the faulty practices vis-a-vis cooking, what you eat, how you process the food, those are transmitted to the daughters. So this is entirely in our hands. So what I strongly feel about is we have to sensitize people. Instead of treating ailments, it is more important to sensitize women how to take care of themselves, starting from anemia at one end of the spectrum to cancers there.
Okay.
And
You have actually आपने एक बहुत अच्छा टॉपिक रेज कर दिया मेरे दिमाग में इस कॉन्वर्सेशन से। तो मनीषा जी, क्या ऐसी बेसिक्स हैं एज अ वुमेन, लेट्स से इफ आई टॉक अबाउट माई सेल्फ, कि क्या जाके मैं बेसिक टेस्ट या चेकअप्स की अपनी लिस्ट बनाऊं? जब हम बोलते हैं कि वुमेन हेल्थ चेकअप थोड़े डिफरेंट होने चाहिए कंपेयर टू द नॉर्मल हेल्थ चेकअप, द रेगुलर हेल्थ चेकअप, तो मेरी क्या लिस्ट होनी चाहिए उसमें? क्या क्या मुझे ध्यान देना चाहिए इंडिविजुअली, ए, एंड बी, जो भी हमारे कॉर्पोरेट्स, एमएनसीज या वर्किंग, there are a lot of working ladies who get some, as an employee, you get some part of your yearly health checkup kitty. क्या एमएनसीज को भी ये थॉट प्रोसेस चेंज करने की जरूरत है? बिकॉज दिस डे, आई मीन, वुमेन आर एवरीवेयर। तो हेल्थ चेकअप्स भी उस तरीके से चेंज होने चाहिए, या उनकी भी अवेयरनेस में ये चीज अगर हम डालें तो क्या होनी चाहिए? मेरे इसमें दो क्वेश्चंस हैं, एक इंडिविजुअल और एक दूसरा, any of the organizations we are working on, because we are closely connected, the word is closely connected, we can't just say कि कोई कंपनी एक हेल्थ चेकअप करा रही है और गेट रिड ऑफ हो गए उससे।
So once again, I'm going to say, Rajni, I'm so happy you asked this again. On one hand, I am sensitizing women that your checkup is not complete. Get whatever is done for the male counterparts, which is an average health checkup profile. And that doesn't mean only blood tests. It's about blood tests, your dental, ENT, eye test, TMT, ECG, and echo if need be. Apart from that, we have separate organs. So for breast, we need to go for sonography, ultrasound, breast, or mammography. See, before 40 years of age, we go for ultrasound of breast. After 40 years, we go for mammography. There is a protocol. We'll talk about that. So according to that protocol, before 40, ultrasound breast, beyond 40, mammography. Then for cervical cancer, we have pap smear. Every woman needs to get it done beyond the age of 20 years, ideally, if she is sexually active. And this has to be continued till 60 years of age, 60 to 65 years of age.
Okay.
Then again, for uterine cancer, uterus has two parts. One is the body, and another is cervix, the mouth of the uterus. So for mouth, we have pap smear. But for rest of the uterus, sometimes people say, Ki, I've got an ultrasound done. There is nothing wrong with my uterus. So the ultrasound looks at the body of the uterus cancer. But when I talk about the mouth of the uterus, then we talk about pap smear. So pap smear, ultrasound of lower abdomen, pelvic ultrasound, we call it, and mammography or ultrasound, breast, as the case may be. So these three are mandatory, which every woman should undergo. Okay. And on the other hand, as a responsible corporate or MNC, yes, I am again doing this. I'm trying to sensitize people. I'm trying to approach corporates to make it mandatory. Sometimes, the annual health checkup in many places, I know it has been linked to KPAs, it has been linked to salaries, incentives. So the same way, women, they are not aware. So we need more and more people to emphasize. Until the time all of our women become aware, it should be made mandatory, at least for the working women. They should have at least 2 breast checkup camps, breast cancer screening camps, at least 2 camps in a year, which should be mandatorily attended by women employees. I'm trying to sensitize corporates, and I seek your help as well in this.
Definitely. As you are making me more informative and sensitizing even me through this discussion, I'm sure, yes, it's going to reach to the larger group of people, definitely. And we need to learn as a woman, yes, we need to look after our body in a certain different way than the other gender. Absolutely, I'm just feeling so, I don't know, I am short of words discussing all these topics, because probably even I think that I'm not that well aware into this side of the area, and probably this sets me next for doing my own checkups.
Can I shock you even more, Rajni?
Please don't do, but yeah, go ahead.
Can I give you another shocker?
What is it?
Breast cancer is the number 1 cancer. We cannot, emphasize it enough. Cervical cancer is number 2 killer cancer of women. And, the deaths can be avoided. These are the cancers where deaths can be avoided. We can control these.
Okay.
Cervical cancer, if detected early, 100% cure.
Okay.
It can even be avoided if we vaccinate all our young girls. You can prevent cancer from happening. We keep telling our patients cancers cannot be totally avoided. But cervical cancer is one cancer. If you vaccinate our young girls, you can avoid it altogether. And in breast cancer, if you do the early detection, then you can avoid the deaths in most of the cases. So that is the irony. The cancers which would not cause deaths are unnecessarily causing deaths just because we are not proactive.
You have mentioned that you can vaccinate yourself for the
Cervical cancer.
avoiding the cervical cancer. What vaccination is this, and what is the age group this happens in? And I'm sure there would be a lot of people who will watch this channel and this information. So I think it's also valuable to know if it can be avoided by a vaccination.
Wonderful. In 95 to 99% of cases, cervical cancer, there is a causative virus, which is human papillomavirus. So we have HPV vaccine in the market, and our young girls, the way we give BCG and DPT vaccination, similarly, 9 to 10 years and beyond girls, if they are given HPV vaccination, so till now we had imported vaccines, Gardasil and Cervarix, but now Serum Institute has provided totally indigenous Cervavac vaccine, and I implore everyone to have their young girls vaccinated. So from 9 to 23 years of age,
Okay.
If we vaccinate our girls, there is a protocol for that. So we can avoid 95% of cervical cancer can be totally avoided.
Okay, so all of you listening to this, please refer to what Manisha ji is saying. If your daughters are in that age group, just have a visit to the gynae doctor and just check what you can avoid in future, because our young kids, I think when they grow and people suffer through such diseases, and it hits people mentally, emotionally also, not just physically. And if there is a way we can avoid it by becoming more informative about it, it's the best way. So Dr. Manisha ji is suggesting something. I request all of you to go and visit your gynaes and refer to that vaccine if your daughters are in that age group. Manisha ji, as you mentioned, that breast cancer and cervical cancer, and breast cancer being the number one killer, I would like to slightly touch upon what are the symptoms initially. Anyone can feel or check through, even if let's say there is a strata, एक ऐसा तबका भी है जो इतने सारे चेकअप्स नहीं करा सकता अपने डेली बेसिस पे, राइट? हर कोई फाइनेंशियली अफोर्ड नहीं कर पाएगा भारत जैसे देश में। जब हम बात करते हैं तो उन लोगों के लिए क्या आप बताना चाहेंगे, एंड इसको हम हिंदी में ही कन्वे करते हैं, बिकॉज आई थिंक अगर किसी को अगर इससे बेनिफिट मिले उस स्ट्रेटा में कि अगर वो लोग ये टेस्ट नहीं करा सकते तो वो क्या विजिलेंट रहें अपने बारे में, अपनी बॉडी के बारे में, कि उनको थोड़ा आइडिया आ जाए कि मे बी मुझे ये प्रॉब्लम हो सकती है और मुझे विजिट करने की जरूरत है इन चेक्स के लिए। तो पहले हम ब्रेस्ट कैंसर की बात करते हैं और फिर आप सर्वाइकल के बारे में बताएंगे।
बिल्कुल रजनी, एंड बहुत अच्छा है, आपके माध्यम से मैं ज्यादा से ज्यादा लोगों तक पहुंच पाऊंगी। अगर आपके पास साधन नहीं है, ये बहुत सिंपल तरीका है, आपकी 3 उंगलियां और एक शीशा, एक मिरर, इतना काफी है। क्या होता है कि जो ब्रेस्ट है, कोई भी कैंसर फॉर दैट मैटर, चोरों की तरह आता है, ना उसमें दर्द होता है, ना उसमें फोड़ा बनता है शुरुआती स्टेज में, वो सिर्फ एक छोटी सी गांठ के रूप में आता है। तो हर महीने ब्रेस्ट का, और ब्रेस्ट में बहुत सारा फैट होता है, तो अगर उसमें आप समझ लीजिए छोटी सी भी गांठ होगी, तो जब तक आप अवेयर, अब एक छोटा चीज बता रही हूँ, जैसे माथे पे मेरी अगर एक फुंसी हो जाएगी या एक फोड़ा हो जाएगा या एक मुहासा हो जाएगा, तो वो जल्दी पता चलेगा, दर्द होने लग जाएगा, क्योंकि यहाँ जगह ही नहीं है। पर ब्रेस्ट में इतना सारा फैट होता है कि छोटी गांठ पता भी नहीं चलती है, अनलेस एंड अनटिल आप उसको ढूंढ रहे हो। तो ढूंढेंगे कैसे? हर महीने सिर्फ 3 मिनट चाहिए, ये 3 उंगलियां चाहिए और एक शीशा चाहिए। तो पीरियड्स के जस्ट बाद शीशे में देखें, कोई गांठ तो नहीं है। नॉर्मली भी ब्रेस्ट में छोटी छोटी महीन गांठें होती हैं जो कि सिग्निफिकेंट नहीं होती हैं। पीरियड्स के पहले कई लोगों को ब्रेस्ट में पेन होता है, दबाने पे छोटी छोटी गांठें पता चल सकती हैं, दैट इज नॉर्मल, जो पीरियड्स के बाद खत्म हो जाती हैं। बट
Okay.
अगर कोई एक ऐसी गांठ है जैसे चने की दाना, मटर के दाने बराबर हार्ड सी गांठ है जिसमें दर्द नहीं हो रहा है और हम दबा के देख रहे हैं तो पता चल रही है, तो तुरंत डॉक्टर को रिपोर्ट करें जाके, स्पेशली अगर एक ब्रेस्ट में है दूसरे में नहीं। और फिर हम कहते हैं शीशे में देखें, कोई लालिमा तो नहीं है, कोई गांठ तो नहीं है, कोई शेप तो नहीं गड़बड़ हो गई है। कई बार निप्पल अंदर की ओर धंस जाता है। और ये सब करना कब चाहिए? पीरियड्स के जस्ट बाद, जबकि ब्रेस्ट थोड़े से हल्के होते हैं। तो शीशे में देखेंगे कोई लालिमा, कोई गांठ, अगर वो नहीं दिखाई देते तो फिर हम इन 3 उंगलियों से गोल गोल करके निप्पल के आसपास से घूमते हुए दबा करके देखते हैं। अगर मुझे कोई ऐसी गांठ पता चलती है जो पहले नहीं थी, तब हमको जाके डॉक्टर से चेकअप करा लेना चाहिए। तो यहाँ पे महिला का चेकअप करना ज्यादा महत्वपूर्ण है। जो लोग सिंसियरली अगर मैमोग्राफी भी कराते हैं साल भर के दौरान, आपने आज एक मैमोग्राफी कराई और 40 के पहले हम कराते भी नहीं है, और अगला आपने कराया 2 साल बाद और बीच में ही गांठ आ गई, तो कैसे पता चलेगा? सिर्फ और सिर्फ जैसे अब यूट्रस का है, सर्वाइकल कैंसर है, उसमें ब्लीडिंग होने लगेगी, सफेद पानी जाने लग जाएगा, पेट में दर्द होगा। यहाँ पे तो कुछ भी नहीं हो रहा, सिर्फ एक गांठ पड़ी हुई है। मैं अक्सर कहती हूँ जैसे अपनी तकिया के अंदर, रुई की तकिया के अंदर आपने एक मटर का दाना डाल दिया, अब ढूंढ के दिखाओ। Unless and until you are specifically looking for it, you won't be able to find it. So every month, diligent breast self-examination is the best tool a woman has in her hand, और ये महंगा भी नहीं है। कब से शुरू करना चाहिए? आजकल, पहले मैं महिलाओं को सेंसिटाइज करती थी 20 से 22 साल में, फिर मैं मुझे 16 साल की लड़की में कैंसर का पता चला। उसके बाद से मैं अब 11th 12th क्लास की लड़कियों को सेंसिटाइज करने लगी हूँ, क्योंकि जब आप आदत डालोगे, आज से आदत, जैसे हम ब्रश करने की आदत बचपन से डालते हैं तभी लोग कर पाते हैं। तो मैं 11-12 क्लास में जब तक लेडीज गर्ल्स पहुंचती हैं 16-17 साल पे, तब से हम हर महीने चेकअप की आदत डाल देते हैं। तो जब भी कोई एबनॉर्मल गांठ होगी तो जल्दी से जल्दी डॉक्टर के पास पहुंचेंगे, क्योंकि पहले के बनस्पत आजकल यंग एज में ब्रेस्ट कैंसर ज्यादा मिल रहा है।
ओके, थैंक यू फॉर दैट इंफॉर्मेशन। इट इज, आई एम श्योर, बहुत इंफॉर्मेटिव है जो आपने टिप्स बताए अभी चेक करने के लिए, सेल्फ चेक्स। बट जैसा कि आपने मेंशन किया कि आजकल आजकल यंग गर्ल्स में ज्यादा मिल रहा है, तो मनीषा जी इसके रीजंस क्या है? इज इट ड्यू टू द चेंज इन द काइंड ऑफ लाइफस्टाइल we you know there is, of course, there is a shift in the way we have been living, and lifestyle changes to eminent hai. Is it because of that? एंड क्या पुराने जमाने में ये नहीं होता था, या हम अवेयर नहीं होते थे इसलिए नहीं पता चलता था? सो व्हाट आर द रीजंस एंड फैक्टर्स फॉर दिस?
हाँ, इसके 2 कारण हैं रजनी। जैसे कि ये पहले था, जब हम लोग, आज से मैंने बोला 30-35 साल पहले, हम लोग कहते थे फैट फर्टाइल। जब 50 साल की वुमन होती थी, तब जो फैट होती थी, जिन्होंने बच्चों को दूध नहीं पिलाया, जिन्होंने शादी नहीं करी, हम लोग इनको जोखिम के रिस्क फैक्टर्स मानते थे, एंड इनमें वी वर लुकिंग फॉर ब्रेस्ट कैंसर और मिलते थे। अभी क्या हुआ है कि 20s में आ रहा है, और जैसे मैंने कहा 16 साल में, अभी मुझे एक 14 साल की लड़की का भी पता चला है, तो उनमें कैंसर हो रहे। तो डेफिनेटली लाइफस्टाइल हैज गॉट वेरी इंपॉर्टेंट रोल, और प्रिवेंशन में भी वही चेंजेस करने से हो जा रहा है। हम लोगों का जैसे सेडेंटरी हैबिट है, बैठने का है, देर से शादियां हो रही हैं, कॉन्ट्रासेप्टिव हार्मोनल प्रिपरेशंस यूज कर रहे हैं, फीड नहीं कर रहे हैं बच्चे को, ये सब हाई रिस्क फैक्टर्स हैं। हम लोग हार्मोनल प्रिपरेशंस दे रहे हैं, चाहे ओसीपीज दें या बाकी दें, वो अगेन पॉजिटिव है। और एक चीज आपको और बहुत महत्वपूर्ण बताना चाहूंगी, जो एनवायरमेंटल पॉल्यूटेंट्स हैं उनका भी रोल है। जहां तक कि जो हमारे एरोसॉल्स हैं, जो हम परफ्यूम यूज करते हैं, रूम फ्रेशनर्स यूज करते हैं, इंसेक्टिसाइड्स यूज करते हैं ना, ऑल आउट, और मच्छरों को मारने वाला, कॉकरोच को मारने वाला, ये सारी चीजें हार्मोनल लेवल पे असर करती हैं। और ये पूरा ब्रेस्ट कैंसर फीमेल हार्मोन्स का ही हिस्सा है, उसी की वजह से ये ज्यादा होते हैं। तो यही जो हमारे कारण है, कारक है, उन्हीं को हम कंट्रोल करेंगे, सो वी कैन प्रिवेंट।
I mean, I can't tell you how, you know, important, rather not, how obliged I'm feeling that I have called you in this conversation today. And I mean, every word of you is information for me. I mean, I'm just so thankful for that, to have you here. And in relation to this, Manisha ji, I want to ask you, uh, हम जब बात करते हैं कि हमारा वर्ड प्राइमरीली दो जेंडर से बना है, मेन एंड वुमेन, और हम वुमेन की बात कर रहे हैं, हम एक जेंडर को अलग नहीं रह सकते, दूसरे का सपोर्ट और सहयोग भी चाहिए। तो इसमें आपको क्या लगता है कि
Sorry, Rajni, I lost you.
wherein they can be
Between, आपकी आवाज नहीं आ रही थी. Could you please repeat that question again?
sure. Can you hear me now?
Yeah.
Okay. मनीषा जी, मेरा सवाल ये था कि विश्व दो जेंडरों से बना है, हम बोलते हैं मेन एंड वुमेन, और दोनों एक दूसरे के पूरक है हर काम में, राइट? तो जब विमेन से रिलेटेड ये प्रॉब्लम्स होती हैं तो सिमिलर हाउस होल्ड्स में ऑफकोर्स मेन भी होते हैं, तो मेन इसमें किस तरीके की मदद या अवेयरनेस, या हम उनके लिए कोई सेंसिटाइजेशन प्रोग्राम चला सकते हैं, या वो किस तरीके से आगे बढ़ के वो भी हेल्प कर सकते हैं, सो दैट समटाइम्स वो जो एक पुशबैक वुमेन दिमाग में रख लेती है ना कि मैं जाऊं या नहीं जाऊं, मैं पूछूं, कई ऐसे भी होते हैं घर में कि मैं पूछ के जाऊं, ये चेकअप कराऊं या नहीं कराऊं, इसकी जरूरत है या नहीं है, इसमें हाउ वी कैन शिफ्ट दैट माइंडसेट मेन का, and how they can be of our help?
दो तीन चीजें हैं रजनी. हमारा आज की डेट में शायद डाइवर्सिटी इंक्लूजन वाले मामले में खाली मेल फीमेल नहीं रह गया है. Everybody has a breast. Everybody has a breast. And so everybody is at risk. You would be surprised to know men में 1 in 1,000 men are liable to get breast cancer.
What are you talking
US में, yes, exactly my point. And US में men में breast cancer is being detected like anything. वहाँ पे तो I was reading a study, 1 in 100 men is getting diagnosed with breast cancer.
Can you help elaborate this, because I'm not able to digest this?
Yes. So out of 100 men who have cancer, 1 is having breast cancer.
But okay, physically we see that men don't have breast, right?
They do have breasts. The only thing is they don't have that much of fat which women have, and that is under the effect of female hormones. That is why आपने कभी कभी देखा होगा पेपर में एडवर्टीजमेंट्स निकलते, गायनिकोमेशिया का सर्जरी करवाएं. ध्यान आया कुछ आपको? गायनिकोमेशिया का मतलब ही होता है, गायनिकोमास्टिया हम लोग बोलते हैं कि गायनिकोमास्टिया इज जब वो ब्रेस्ट बड़ा हो जाता है मेल्स का. So yes, so lots of boys. I know a very close friend of mine. She brought her son, and the boy, he was like 18, and he was so conscious. And I said, you better take him to a surgeon for examination. But does this happen? I said, yes. वो breast बड़ा हो जाता है. They get reduction surgeries done. And irony is कि many a times they go for these advertisements instead of going to a breast surgeon, जो रिड्यूस भी कर देगा और एट द सेम टाइम चेक भी कर लेगा कि कोई गांठ तो नहीं डेवलप हो रही है. एंड मेन में क्योंकि फैट की लेयर नहीं होती है, सो गॉड फॉरबिड इफ कैंसर अराइजेस, इट स्प्रेड्स वेरी फास्ट.
Oh my God. Okay.
There is no fat cushion. So that is one myth कि it happens only in women. Men में भी होता है. Men need to be cautious. So they need to be aware of the changes again. And then we come to Indian perspective. हमारा जो society है, तो women usually husbands motivate करते, even health checkup के लिए spouse को men ही ले जाते हैं. जैसे मैंने कहा companies के पास होता है, वही ले जाते हैं. And then again, many a times it is the partner, the husband, the spouse जो कई बार discover करता है.
Okay.
Yes. So actually I tell my women कि अगर तुमको hesitation लगता है या आपको confusion लग रहा है ना, so get it done by your husband initially वाला, take help of your husband because they can't see. So कई बार men detect करते हैं, and doctor के पास ले जाने में women are very shy. They don't even go to the lady doctor about this breast. एंड सर्जन्स हमारे यहाँ कई जगह पे सिर्फ मेल्स होते हैं, सो दे डोंट वांट टू गो टू ए ब्रेस्ट सर्जन, दे लैंड अप टू विद एनी डॉक्टर. So I tell them either go to a breast surgeon or go to a gynecologist who will direct you further. So men have a very important role. यहाँ पे डॉक्टर तक ले जाने में, ट्रीटमेंट डिसीजन लेने में, women are wary of getting surgery. So क्योंकि उनको पता चलता है कि अगर कैंसर निकला है तो पूरा ब्रेस्ट हटा दिया जाएगा. So one is fear of cancer, other is body image issues. तो वो डॉक्टर के पास जाने को नहीं तैयार होती अगर निकल आया तो यहाँ पे हस्बैंड का बहुत इंपॉर्टेंट रोल होता है कि उसको मोटिवेट करके ले जाएं. और जब मान लीजिए कैंसर निकल आया, ट्रीटमेंट हो रहा है, उसके आगे की जर्नी ना बहुत टफ होती है, बहुत दुखदाई होती है और बहुत लंबी होती है और बड़ी ट्रॉमेटिक होती है. तो वहां अगर स्पाउस का सपोर्ट नहीं होता है तो बहुत मुश्किल आती है. सो मेन नीड टू बी सेंसिटाइज स्टार्टिंग फ्रॉम, आपको भी हो सकता है, better check yourself too. Don't ignore any simple सी lump, एक गांठ जो आपके पास हो. जैसे मैं गांठों के बारे में बताती हूँ, अगर मोती के साइज की मिल गई, चने के साइज की मिल गई, मोस्टली वी कैन सेव दीज लाइव्स.
ओके.
कुछ वैरायटी होते हैं जैसे इन्फिल्ट्रेटिंग डक्ट कार्सिनोमा, वो बहुत तेजी से फैलते हैं, बट जनरली स्पीकिंग जो अगर मोती मनके की साइज की हुई, चने की साइज की हुई, तो विद सर्जरी वी कैन सेव द लाइफ. फिर नींबू साइज पे हमारे पास ज्यादातर साइज आता है नींबू का साइज. आई हैव सीन ऑरेंज साइज ऑल्सो, अल्सर हुआ साइज भी. तो उतनी देर पे क्यों आए? अगर हम हर महीने चेकअप करेंगे ना तो हम आ जाएंगे ना मनके के साइज पे, एंड देन वी कैन सेव लाइफ. दैट इज द पॉइंट. I'm afraid I keep elaborating, bringing in more points in answer to your questions, but I think these are the things which are very important for women to realize.
No, it's very much required. I think जो भी आप mention कर रही हैं ये बहुत ही informative है. मैं again बोल रही हूँ, मेरे लिए informative है तो I'm sure जो उसको सुनेंगे उनके लिए तो बहुत informative है, क्योंकि you have very rightly touched वो body image issues एंड वो फैक्टर ऑफ शाइनेस जो है, शर्म आना कि हम दिखाएं नहीं दिखाएं या क्या दिखाना छोड़ो अगर कहीं निकल आया. एंड आई कैन रिलेट इट बिकॉज इन माय ओन फैमिली माय मदर वेंट थ्रू दिस सर्जरी एंड वी हैड सीन द फेस completely. Rather after that, my sister and myself, we did the ultrasound. As you mentioned, under 40 ultrasound hota hai. So we did all of that. So I know what you're talking about, and I know हम कितने careless हैं अपने को लेके खुद. जब हम एक इंडिया जैसी कंट्री की बात करते हैं तो बहुत सारी ऐसी डेवलप्ड सिटीज में हम लोग ऐसे हैं. तो आई एम श्योर आपके सामने जो केसेस आते होंगे शॉकिंग एंड सरप्राइजिंग होते होंगे. इसी से मनीषा जी मेरा अगला सवाल जुड़ा हुआ है. जैसे आपने साइज बताया मोती, मटर, चने या नींबू के साइज का, इसको आई थिंक हम मेडिकल लैंग्वेज में ऑल्सो ऐसे स्टेज 1, स्टेज 2, स्टेज 3, 4 कहते हैं. तो किस लेवल तक के कैंसर को, किस स्टेज तक के कैंसर को क्योर किया जा सकता है और लाइफ बचाई जा सकती है? और जब हम स्टेज की बात करते हैं तो क्या उसका रिलेशन इस साइज से होता है, या जैसे आपने बोला ऑरेंज साइज हो गया, या तो इज दैट द लास्ट स्टेज? आई एम जस्ट आई एम कंप्लीटली फ्रॉम अ नॉन मेडिकल बैकग्राउंड, सो माय क्वेश्चंस माइट sound little different to you, but I hope you can interpret.
I'm glad you're asking these questions because these are the things which women need to know. So first of all, I would say whether it can be cured or the life can be saved doesn't depend on the size alone. The staging doesn't depend on the size. Definitely size has an important role. Then the grade of tumor, the type of tumor जो हम बायोप्सी से देखते हैं कहाँ से निकला. जैसे मैंने अभी मेंशन किया था infiltrating duct cancer, so that spreads through the ducts, so it spreads very fast. Whereas if we have a small lump in the fat, so it can grow to be a big size and then we can remove, and that is the basis of conservative surgery we do nowadays. Nowadays we don't remove the whole breast if it can be if it is not like of an advanced stage, it can be removed in toto, then we don't do massive surgery. Conservative surgery can be done. So it depends on the grade, the stage, the type of tumor, where it originated from. And then again, another thing, whether the skin has been infiltrated or not. And nowadays we have markers also. We talk about estrogen, progesterone receptors, and there is another thing, HER2 factor. So we have to take all that into account. So we talk about positive. So here positive is good. If I have ER/PR hormonal positive, that means I have a drug to take care of this.
आपको समझाना पड़ेगा when you're saying ER/PR positive.
जो हम लोग ऑपरेशन करते हैं ना, तो फिर वी डू बायोप्सी के ऊपर भी हम कुछ हार्मोनल सेंसिटिविटी टेस्ट करते हैं.
Okay.
तो अगर मेरा हार्मोनल सेंसिटिव, बहुत सिंपल शब्दों में कहूँ, अगर हार्मोनल सेंसिटिविटी पॉजिटिव आ गई, तो मतलब मेरे पास उसकी काट है.
ओके.
वो दवा है मेरे पास जो उस हार्मोनल, जब सेंसिटिव है तो वो मेरी दवा उसके ऊपर एक्शन करेगी. सो अगेन आई हैव ए काट उसके लिए. तो दैट आई कैन डू. वो सिंपल शब्दों में. तो ये सारी चीजें डिसाइड करती हैं वेदर द how much of surgery is required, after surgery whether chemotherapy, radiotherapy, hormonal therapy is required. But I must say a very positive thing. In India we have the best, I would say the latest techniques available to us presently in India. In metros, at least, in Mumbai, Bangalore, Delhi, we have all these things available. Now the onus is on us, on women, to reach there early. Okay. And for people like you and me, it is very important to, sensitize more and more women. यहाँ पे मैं एक चीज आपको बताना चाहूंगी रजनी. You are not the only one. I too lost my mother. I too nahi, that's the wrong word. My mother too had breast cancer. We lost her, unfortunately, because it was a very aggressive type of cancer. Then again, younger girls have more aggressive type of cancer. Again, I want to highlight that factor. So that is one thing. And I find more and more women, my friends, doctors, they have had breast cancers. Doctors, I'm talking about gynecologists. You don't have control over that part, but definitely you can reach the place early. So that is the point. And in my book, I'm sure you must have read the book. There are 9 stories, and they are all real life stories. And because I have taken, once you read them, you will find these stories are from all around you. The simplest of things explained what we ignore and why we should not be overly worried. Take action, but don't be overly worried. So it is very common. I mean, 1 out of 9 means yes, हमारे अड़ोस पड़ोस में आ गया है.
I have so much respect for the work you're doing, actually. Honestly, health is, sometimes we least think about it unless we reach a point in our life where we realize, okay, I should have done this before, I should have taken care of this thing before. But जो आप काम कर रही हैं मनीषा जी, बहुत अच्छा है. आप खुद उस एरिया में एक्सपर्ट हैं, आपका एक्सपीरियंस उस एरिया में है, प्लस अब आपने उस पे बुक लिखी है. Again, I would like to call her book name over here, 9 Lives and Many More, Being Breast Aware. So folks, all of you who are watching this, be breast aware, get early checks done. बात के लिए मत वेट करिए. Just like इसको regular health checkup का अपने part बनाइए. मनीषा जी, if I'm correct, हमें yearly साल में एक बार कराना चाहिए, right? या इससे ज्यादा भी?
इसका ये प्रोटोकॉल हम कहते हैं, जैसे हम बोलते हैं जो गाइडलाइंस हैं वो कहती हैं 20 साल के बाद every month one should do a breast self examination. Okay. I have started preaching, I would say consulting, counseling 16 years onwards, because I take that window for habit forming, and then we have cases occurring at earlier. So right from 16, I would say, till the age of 39, initially I do self breast examination. Every 3 years, go to a doctor for checkup. If you're going for anything, and I actually request all the doctors also, any female doctor, if a woman is coming for anything, एक बार breast checkup जरूर कर दीजिए और सिखा दीजिए. I keep telling everybody. Okay. Then that is till the age of 39. If there is some problem, then we ask for ultrasound. If a girl is like from in 30 to 40 bracket, as part of annual health checkup, I actually say a request for an ultrasound. It is part of your package, but it is not mandatory, I must tell you. So if there is some problem, get an ultrasound done. If you have the facility, at least avail it. And beyond 40, starting from the age of 40, mammography that is mandatory.
Okay.
So
And till what
initially,
age, Manisha ji, mammography should be done?
from 40, I keep saying ki from the guidelines say every 2 years it should be done. Beyond 50, it has to be an annual thing. Every year mammography, and we have to continue till 70, 80.
Okay.
What
So
the
it's like your
recommendation?
entire lifespan, you have to be breast aware.
Because I myself have seen a woman at the age of 90,
My goodness, you
and
have given
she
me
was
shocking
not ready
news.
to open her. That was one incident. There was
Yeah.
language barrier also. She was a Tamilian, and she would not understand my thing, and she had come for stomach pain. So I wanted to examine her, and I found her liver to be very hard. कि cancer type का liver लग रहा है. So after that, I have this reflex. I've been doing this for a long. As I said, my mother had it, so I was sensitized very early. So every woman I would come across, I would do this. I
Hmm.
started checking her breast. She refused to. She wanted to get away from the table. कि कभी कुछ नहीं हुआ मेरे तो बच्चे भी normal हुए, and now this young lady doctor is asking me to open my breast. And she was ignoring it. Her entire nipple had sunken up to the chest wall. And it was a breast cancer which had progressed to her liver.
Oh my God. Okay.
And she was 85 or 86. She lived to be 90, and then she passed away.
Okay. You're
You know,
giving me these shocking numbers in terms of age when you said you had a case of 14-year-old girl and then a 90-year-old you're telling me.
yeah, yeah.
Plus, as we touched upon the topic of even men having breast cancer cases in US and in India also.
Yeah.
मनीषा जी, इस केस में मैं लास्ट क्वेश्चन जो टच करना चाहूंगी कि जब हम बोलते हैं कि आदमियों में भी ये चीज आने लग गई है, उनके पास फैट नहीं होता तो जल्दी स्प्रेड होता है, आपने बोला,
Mhm,
उनके
mhm.
लिए क्या क्विक आप टिप्स बताएंगे? हाउ कैन दे चेक कि उनको है या
Same
कुछ?
way, same way. They have to be, actually you have to sensitize them कि आपको भी हो सकता है. So when you are, it is easier to do it in the bathroom. Look into the mirror. They can also actually once a month they can also check. Women में ज़्यादा ज़रूरत होती है. They can, the frequency can be lower in men, but they have to be sensitized to this. कि even if you have a small lump in your breast, examine the nipple and around, go in the circles, and if you have any small lump, don't ignore it. Many times people think चोट लगी है तो गांठ हो गई है. And when women are so conscious about their breast, obviously the men too. So the
And I
only
think
thing,
you won't even go into a consuming mode up for this statement कि मुझे कैसे हो सकता है, जब मैं सुन के बोल
yeah,
तो कैसे हो सकता है, तो they
yeah.
I don't even have breast, how can I have breast cancer?
So for them, I tell them कि if you have a lump in your breast area, I have to be, delicate about it, as I told that lady. So if you have in the chest wall, if you have a hard nodular thing in your chest, in the breast area, please go and show to a surgeon. So that, and important thing, as I said, the thing could be very hard, very small yet hard, and it is not painful.
Okay.
That is a significant thing. Otherwise, all the boils and everything, they are painful when you press upon them. So
Hmm.
this is very important.
Hmm. This session has been so informative, Manisha ji. मतलब time का तो पता ही नहीं चल रहा है. I'm just feeling like मैं आपसे क्या क्या और ना पूछूं, and definitely we'll keep meeting offline this video also, and we'll keep that connect. This coffee doesn't stops here. You never know if we may require another session or a series for this to talk more about, let's say, cervical cancer in the next. So we will discuss and talk about that. But then again, hats off to the job you're doing in terms of, and it's very important to sensitize and cover this topic as part of women's health, which has been ignored from years and ages. And I think there is some resistance even till this date on this topic. बहुत अच्छा आप काम कर रही हैं, ऐसे ही सबको सेंसिटाइज करते रहिए, और जिस माध्यम से आपने मुझे सेंसिटाइज किया, आई होप इस माध्यम से और लोग सेंसिटाइज हो, एंड आई विल आल्सो टेक फॉरवर्ड दिस मैसेज to many as possible as I could. And one thing I want to ask you before we close our today's session is what is the message you are trying to deliver through your this work and experience into this area, be it your book, be it your own work? What is that one thing you want to convey to our audience today?
Yeah. That is, breast cancer is the number one killer of women. Every minute, a woman somewhere in the world is dying of breast cancer. In India, every 13 minutes, a woman is dying of breast cancer, and deaths can be prevented if we detect it early, if we prevent it by modifying our lifestyle so that we ourselves don't contribute. So, the thing is early detection of breast cancer through monthly breast self examination and going for promoting a healthy lifestyle so that we can cut down the threat of breast cancer. That
Okay.
is the only way we can save our women, our loved ones, and this is what we owe to ourselves as well. For
I'm
people
just
like
feeling
you
like
and me.
I'm just feeling like I should continue talking on this topic, but मैं इसको यहाँ end नहीं करने वाली हूँ क्योंकि आपने बोला कि lifestyle also has a role in it. If quickly you can touch upon कि lifestyle में क्या changes हमें ऐसे लाने चाहिए जिससे हम इसको I don't know avoid कर सकें या कभी ये हो ही ना.
Very nice. Kabhi ye ho hi na is not possible because it is, yes, this is genetically transmitted. BRCA1, BRCA2 genes hote hain aur bhi bahut sare genes hote hain. It runs in the families. So that we cannot avoid. There are others like even if it's without genes, cancer is something, aberrant. Cells start misbehaving, they proliferate like any other cancer, lung cancer, liver cancer. So we cannot completely prevent it, but we can cut down the threat. And that is similar to all the cancers, our diet. We are taking, and if you ask me a single thing, कि diet में एक single thing क्या करें, I would not talk about balanced diet and all. वो सब लोग पढ़ सकते हैं, Google कर सकते हैं. I would just say stay to the nature as far as possible.
Okay.
No processed foods, no packaged foods. वो avoid कर देंगे. That will be the single most important thing. जैसे हम पहले खाना खाते थे दादी नानी के टाइम पे, if we stick to that kind of food, most of the cancers in the body, then
Going back to roots.
yeah. And that doesn't mean taking packaged organic food.
Yeah.
Go for fresh fruits and stick to the greens. Number two, lifestyle modification is physical activity.
Okay.
Because physical activity releases certain hormones which are, countering these risk factors.
Okay.
Hormones को modulate करते हैं. Breast cancer is a hormone mediated cancer, breast and uterine cancer. So again, that will be risk will be cut down. Number three, cutting down on alcohol and smoking. This is very important.
Okay. Okay.
Yeah. So these are the many important things. Three pronged approach, I would say. In general, there are many more things which we can talk about. Maybe some other time.
Yeah, I'm definitely having a gut feel. Rather, I'm very confident we're gonna have a series, connected series with it, where we'll talk more about it. But the three major pointers which you said about healthy lifestyle was eating healthy food in terms of less processed food, rather no less. I mean, if we can cut the processed food, having more fruits, vegetables in our diet. The second pointer which you mentioned was
physical activity,
so that the right hormone discharge keeps happening in the body. And the third pointer from you was
cutting down on alcohol, smoking, caffeine.
Caffeine also.
Yeah.
Okay. I was just thinking what in this list I'm not doing. The caffeine is okay. I would have to think about the caffeine part. So yeah, I mean, all the people who are listening, please adopt a healthy lifestyle. Eat as much as fresh from the farm, if possible. If possible, if you're living close to nature, nothing good than that, better than that. And as Manisha ji mentioned, no alcohol, no smoking. So all city people, please. I know there are a lot of pubs, but yeah, think before you do all of that and how often you want to do that. And make exercise or moving your body in any form as part of your life. And I think going back to basics and living, as we say, going back to our roots is the best way to avoid any kind of disease and challenges later in our body. And thank you once again, Manisha ji. I cannot thank you enough for this session. I can't tell you how happy I am having this interaction with you. I was not even thinking of it to go in this way and this informative and such eye-opening for me too in many cases. I mean, there were a lot of bulb-on moments for me, wherein I just felt, यहाँ पे तो दिमाग की बत्ती जली है मेरी भी, and I was also not aware of. And I'm sure जो भी लोग इसको देखेंगे, please इससे आप अपने health के लिए जागरूक होइए, समय पे जाके चेकअप्स कराइए, अपनी बॉडी को खुद पहचानिए. जब हम कहते हैं सेल्फ लव, तो लेट्स आल्सो गिव सम परसेंटेज ऑफ दैट लव टू टेस्ट आवरसेल्फ इन टर्म्स ऑफ व्हेन वी से women health and specifically women parts, breast, uterus, all reproductive parts. Go and get yourself checked, adopt a healthy lifestyle, and go ahead and read more details through Manisha ji's book. It's available on Amazon. I'll also drop a link here when we drop this video. So thank you once again, Manisha ji. It's been such a pleasure having you here. I can't just keep on saying that. And
I would say thank you. It's been a pleasure being with you. You just brought out the right questions, the messages which I wanted to convey. And thank you so much for giving me this opportunity to reach out to, because that is almost a mission in my life, to reach out to as many women as possible. And so you are also one.
And we need women change makers like you. And, definitely it's, as I say, bulb on moments for me and maybe for many who's going to see this video. And I am definitely sure we're going to have another shoot of Coffee with Women series with you. And we're going to continue such coffees more with you to help you on your mission, and also bringing close our women to be more empowered even in a health sector.
Anytime. And it will be, it will be very nice for us, people like Rajni. I must tell you all, people like Rajni, they are out to empower women. And this is my little way of doing. And I'm so privileged to have you on board, Rajni. Thank you so much.
Thank you so much, Manisha ji.